Hands, face, space. For most of us, obeying the official instructions to prevent the spread of COVID has become a ritual, if not quite second nature.
Keep the gloves on, clean the chair before and after every customer. New gowns, we have sanitizers, everything. We're doing our best, basically, to just keep it.
Great, thanks very much.
Now that we're allowed back into even so-called non-essential shops, antivirus measures, which may be costly and dramatic, are proudly on show. But more than a year into the crisis, we should know by now what works and pointless motions we're going through just to make us feel better. Oxford professor Jennifer Dowd is one of the self-described nerdy girls who've been examining the evidence on their Dear Pandemic site.
Unfortunately, I do agree with the term hygiene theater in the sense that I think a lot of this is about making us feel safer. Small businesses want customers to come back in and feel safe, and these are things they can demonstrably do. But I think that the danger comes when it could be doing more harm than good.
Plexiglass screens obstructing air circulation are one of their bête noire. But topping their hit list is obsessive cleaning of surfaces, so-called fomites, where infection might possibly be found.
The US CDC has reviewed the data and changed their guidance pretty recently. And their assessment of the data was that even if you touched a contaminated surface, your chance of becoming infected was less than 1 in 10,000. And there's just a whole series of events that would have to happen. Someone very infectious would have to sneeze or cough directly onto a surface that you touched, very shortly thereafter. You would then have to get that somehow into your nose or eyes and your mucous membranes in order to have an infection. It's not the same as breathing in all of those tiny particles.
At the beginning of the pandemic, we were encouraged to stay off public transport for fear of spreading contagion. Now, innovative ideas are being developed to encourage people to get back on the buses safely.
As it's pumped through the nozzles, the fluid is aerosolized to create a very fine fog, which spreads all the way through the vehicle.
And this all happens in the middle of the night, is that right?
This can happen in the middle of the night when the bus is out of service.
Reassuring customers they're safe costs D&G Bus Company in Stoke-on-Trent about £3,500 per bus to install the V-Stop sanitation system. After that, it's just £1.50 per clean, automatically with no staff required. D&G are giving priority to their routes serving hospitals. There are obvious applications for enclosed environments. Qatar has already been in touch re its mass transit systems for the World Cup. In general, for the rest of us, now that the infection rate is subsiding here, the best protection is a healthy blast of fresh air. Adam Boulton, Sky News.